Thankfully, we have with us this morning a panel of experts here to answer all your questions about all things money, including healthcare, which we are focusing on this hour. We also have healthcare advocate Jeff Knott.
He's the author of the book, Navigating the Healthcare Maze. So, Jeff, we're very excited that you're here.
Jeff, we need navigation tips over here. And, of course,
welcome to Tampa, beautiful Tampa, 110 degrees today. There are now 102,000 people waiting for a transplant today. 80,000 of those people are kidney transplants. And the main reason for renal shutdown, as the doctor will advise you of, is because of diabetes. And if we have more preventive care, then we will hopefully at some point not have this situation.
We have to unclog these emergency rooms. That's part of our problem. And this kind of plays along with what Dr. Siegel's saying. So how do we go about doing this then?
No, I agree. I agree exactly what Dr. Siegel just said. One thing I think is important, that we live in a discriminatory healthcare society, that even though you may have a lot of money, you can go to the Mayos and you can go there, but on a day-to-day basis, we need a plan that allows the average person to have a specific health care examination and so on. But you're not going to get a total major surgery under that plan, but at least you'll get a coverage of some kind. I couldn't agree more with Dr. Siegel. I think he's right on the nose here. And the other thing is, supposing we do have another 46 million people with insurance, where are you going to take the insurance card to? We don't have enough doctors. So let's get real about this. And we, as a consumer, I'm a consumer, we have got to do a better job in interacting in this whole process. And we forget about this. We have all these people, we're talking daily about healthcare reform, and yet I'd like to see more communication between the reform and consumers.
Right.
You know, am I right thinking, doctor, that about in the last 10 days of your life, 70% of your total healthcare costs are spent in the last 10 days, more or less?
You know, that's a very good point. That certainly needs to be addressed. I'm not trying to dodge that issue, that we have way too much money and resources spent on people that are not going to get better. I grant that. I just don't think the government should be making that decision.
But
no,
again,
I agree. But it's an ethical question that we're going to see more and more of in the coming years.
Let's just spell it out.
Let them
government-mandated euthanasia. How long are you going to keep somebody alive at the end of their life? Because, again, Medicare is a huge problem.
Jeff, in Tampa, sunny Tampa, what do you think about all this? I mean, it's a valid point. Our congressional leaders are sitting pretty, and they keep getting reelected to boot.
Yeah. Well, what's interesting, 2 points. The first one is the gentleman that was talking about Medicare being extended. Well, in fact, 133 million people have a chronic disease, and they're getting sicker earlier, not later, even though you'd like to believe that healthcare quality has improved. Overall, I don't believe it has. So I'm not in favor of that side of the coin. I think we should leave it where it is, but have more preventive care. Relative to the question about your question on the federal government's health care plan, I took a good look at Blue Cross Blue Shield. And in fact, they're managing a lot of these kind of programs. So if you look at that kind of managed care, and I agree with Dr. Siegel, again, unfortunately, Dr. Siegel, I'm agreing with a lot of everything you said.
Not unfortunate.
Well, he supports the Obama plan, so we have some conflicting views here.
But, you know, overall, quickly, you know, we're going to come out with some plan here, for sure. And it's going to be more centrist, and we're going to have a bipartisan agreement on this. But the what-ifs and what-ifs, I've lived through 26 years in the British healthcare system, so I know that side of the coin, too, later on. But overall, I couldn't agree more on this, what Dr. Siegel just said.
Well, we're going to talk about Great Britain in my true-false quiz that I wrote at 3 o'clock in the morning. So that brings me to this week's true or false healthcare around the globe. Number one, Great Britain has one of the cheapest government health care programs in relation to the GDP of the country. True or false?
Oh, I need Jeff Knott. I'm going to say, first of all, 3 o'clock in the morning, this is what you're thinking about? I'm going to say true.
Ding, true. It is one of the cheapest. It's about, at last look, and a shout out to the Cato Institute, it's the libertarian organization. It's about 7.5% of GDP, I believe, last year.
Oh, and we're looking at what, 15% here in the United States?
But Dagan and Tracy, there's no complete, wonderful, socialized medicine in the world.
I know,
you
but
could
that's my
wait
next
a
question.
long time.
That's my next question. So
I'm
number
sorry.
two.
I didn't mean to interrupt.
He was the kid in the front row the whole time going, ooh, ooh, ooh.
No, Jeff, listen to this. Number two is Great Britain has some of the longest waiting lists because the savings come through rationing. True or false? Tracy?
You want me? True.
Yes. That's the point, right? So I was saving the punchline, Jeff Knott. Right? They got some of the worst.
Absolutely. And the same applies in Canada, too, would you believe? 60% of patients go to a very well-known hospital just over the border from Canada, are from Canada, right. Of the foreign patients coming in, so because the waits are so long. But seriously, if I may just jump in,
yes.
51 billion is a number I throw out that I've read, is on medical code errors. Miscoding. Is that true from anybody else on the panel there?
That is true, actually, Jeff. That is true, and I think the solution to that is just more efficient billing. That advantage will come 10 years from now by putting everything on electronic medical records. So it is a positive, but it's going to take a long, painful transition.
But you support the president's plan, so how are we going to...
Whoa, Tracy, Tracy, no. I'm right in the middle. Some of it is very unrealistic. But I think somewhere in the middle they're going to come together because everything everybody's just said is true. But there's so many tentacles out there. You haven't even mentioned, like, frivolous lawsuits. We haven't even talked about
malpractice. We haven't talked about it all yet.
Insurance reform. I think it would become more competitive if we do have something. But we've all got to take a bit of pain in this because somebody in your family has a chronic condition at some point, maybe now unemployed, uninsured with a chronic condition, not getting Medicare. What are we going to do for them? I have no problem paying for extra in taxes in order to take care of that person within my family. But this is a multifaceted, complex issue we're talking about.
Jeff, we do it in all other industries, and we don't do it in healthcare.
Yeah.
Jeff Knott?
Yeah, it's absolutely good question. I mean, when you buy a house, what do you have to have mandatory? If you're in some sort of flood area, you've got to have flood insurance. You've got to have, all these various things. Is this the only thing we don't have? Is in the healthcare area. So yeah, I mean, we've got a lot of work to do here.
Jeff Knott, thank you so much. Jeff Myron at Harvard, Dominic Tavella stays, and Dr. Mark Siegel, thanks to all of you so much.